Lab procedure and equipment used prior to try-in steps involve face bow transfer, articulation, teeth selection, determining the occlusion, teeth arrangement, and wax up for try-in. Here are the list of steps involved in instrument required. One important step is, before articulation we do require some intraoral records, which is developed by using tracers, and those records will be required in programming the articulator. This step is required if you are giving the patient balanced occlusion, otherwise we can simply articulate the tentative jaw relation record, which will provide only opening and closing, not the lateral movement. Gothic arch tracing system, also known as arrow point tracer or height tracer. Uses 1. Gothic arch tracing devices are used to verify or confirm centric relation obtained by other methods. 2. They are also used to obtain protrusive and lateral records. Available as 2 types. 1. Intraoral, arrow points posteriorly, and 2. Extraoral, arrow points anteriorly. This diagram, showing the intraoral tracer, where tracer are placed inside mouth. And this is extraoral tracer, where the tracer is placed outside of the mouth. Next is articulator. It is defined as a mechanical device which represents the temporomandibular joints and the jaw members, to which maxillary and mandibular casts may be attached to simulate jaw movements. Uses of an articulator: to diagnose the state of occlusion in both the natural and artificial dentitions, to plan dental procedures based on the relationship between opposing natural and artificial teeth. For example, evaluation of the possibility of balanced occlusion. To aid in the fabrication of restorations and prosthodontic replacements. To correct and modify completed restorations to arrange artificial teeth. Classification of the articulator: it can be classified based on the theories of occlusion, based on the type of record used, based on the ability to simulate jaw, based on adjustability. Simply remember this chart to know what all the things are capable of recorded. These are the parts of articulator we commonly used. It has upper member, lower member, condylar guidance, condylar element, incisal pin, incisal guidance table and mounting plates. After mounting, start with the teeth arrangement of upper anterior, lower anterior, upper posterior, lower posterior. Always check glass plate relation after placing each and every tooth. Apply the principle of teeth arrangement. For this you will need glass plate, wax spatula, wax knife, lacrone carver, and chip syringe. In the try-in procedure, 2 primary evaluation in the articulator: evaluation of impression surface. For adaptation, evaluation for polished surface. For void and harmony of tissue contour, evaluation of occlusal surface, free of wax, gingival margins. When evaluating in mouth, check for retention, stability, support, aesthetics, lip and cheek support, evaluation of occlusal plane, evaluation of centric relation, evaluation of vertical height, eccentric relation, incorporation of PPS.